Good evening, everybody. Thank you so much for coming. My name is Kaitlin. I am the physician assistant and owner at Alpine Functional Wellness, and I'm here to talk about peptides, the future of personalized medicine. So peptides are little polymers of amino acids. So if a peptide is if it's less than 100 polymers, it's a peptide, and greater than 100 is a protein. Peptides play a role in cell signaling, hormone regulation, and immune function. When we use peptide therapy, we use synthetic or natural peptides to mimic the body's own function. And peptides are customized to you, which makes them the future of regenerative medicine. There are some drug interactions with peptides. You cannot take them if you're taking antihistamines, saw palmetto, or steroids. You can take them with PPIs, but you do have to stop the PPI 2 days before and 2 days after the peptide injection. And that would be like omeprazole, pantoprazole. There are some contraindications if you have a history of cancer or if you're immune compromised. We can't use peptide therapies. And autoimmune disease is a relative contraindication. So if you were having a flare, it would be contraindicated. But if it was like a latent autoimmune disease, then you would qualify for treatment.
Kaitlin, quick question. Any history of any kind of cancer?
Yeah.
Pretty much. Okay.
Yeah.
Okay.
Unfortunately. So common benefits of peptides include anti-aging effects. So a peptide like collagen would promote skin elasticity, eliminate wrinkles. Peptides also help with weight loss to regulate fat metabolism and promote weight loss. And they help with cognition. They can actually help with neurodegenerative diseases. So they enhance memory, focus, and clarity. Peptides can help with athletic performance, increasing growth hormone, which can help with tissue repair, increasing muscles, shortening recovery times. And it helps with your immunity and joint pain.
One of our participants on Zoom said they want all that.
Somebody online?
Yeah.
Yeah,
They want all those things.
all of the above. It was all looking for it.
These are some common peptides. At our office, we'll actually offer BPC 157 and then some of the growth hormone stimulating peptides, and maybe more later. But like I said, they increase immunity. They can help with weight loss, skin repair. So if you're sick or you think you might need peptides, we can use them for longevity and extending our health span, for anti-aging effects, for injury recovery, athletic performance. After surgery, it works well for tissue repair, and they actually help with mood, like anxiety, depression as well. So one of the most common applications that we'll have in our practice is growth hormone increasing peptides. And you'll notice that the symptoms of growth hormone deficiency are increased fat, decreased lean muscle mass, listlessness, poor exercise performance, reduced bone density, central adiposity. So all of these symptoms mirror all of our symptoms when we have depleted hormones. So when you come to visit me at Alpine Functional Wellness for peptides, we'll actually start with a hormone workup. And we'll optimize your hormones and look at your thyroid, and we will check your cortisol and make sure that all of those things are normal before we would supplement you with a peptide to increase your growth hormone. But there is hope. So this is an example of how all of these factors play into each other. So stress can increase your cortisol, and then cortisol plays on your growth hormone to give you metabolic syndrome. Or cortisol can deplete your sex steroids like estrogen, testosterone, to give you reduce bone density or osteoporosis. But if we can give you growth hormone releasing peptides, you'll see like an opposite of everything. So decreased body fat, increased lean muscle mass, better sleep, increased insulin growth factor production, increased bone density, cellular repair, and wound healing. So one of the peptides that we'll carry is samorelin. And samorelin is a secretagogue that stimulates the pituitary to release hormones. So it acts in your brain. We can't just supplement you with growth hormone. It would be easy and simple, but your body gets confused when you just take growth hormone to increase growth hormone. It loses the disconnect of its own. So when we stimulate the peptides, it's a more natural process for your body. But samorelin, it spurs the growth of new tissue, which is how you get all these great relief of symptoms, increased energy, vitality, increased endurance, collagen. So when people take samorelin, they might notice one of the first things is that their skin looks better, like less wrinkles on their face because their skin is like thicker, and increased mood. So the other peptide that we'll carry at Alpine Functional Wellness is BCP 157. And we will carry this for a number of reasons. It promotes growth and increases fibroblasts, which are little pieces, they increase cell development. And it actually functions with angiogenesis, which increases new blood vessels. So this all relates into the tissue repair. But BCP 157, it acts in our gut. So it can help with ulcers, irritable bowel syndrome, irritable bowel disease like ulcerative colitis and Crohn's. So if you have a history of IBD and you go to your gastroenterologist and you've tried Remicade, don't get surgery before you've tried BCP 157. That would be kind of like the time frame when we would apply it, is like after traditional medications, before surgery. But it might be able to heal your gut. This application also works for allergies and some viruses. So if you're somebody with like spring or summer allergies, we could definitely do a trial of BCP 157 without going through the whole hormone workup. And that holds true also if you're having a surgery. We would support you with peptide therapy for a couple of months without the whole workup, just knowing that they have such an increased effect on tissue repair. So I also wanted to touch on my MIC injections that I've been offering Help and Glow this whole time. These are 3 amino acids, which is why they tie in tonight, because remember, peptides are chains of amino acids. So MIC stands for methionine, inositol, and choline. And methionine, it helps with fat lipolysis. So it turns fat into usable energy. And it removes heavy metals because methionine is a precursor to glutathione. And we love glutathione because it, like I said, it removes heavy metals, free radicals. It helps detoxify your liver from like alcohol. Then we also have inositol, which also helps with fat lipolysis, turning fat into energy. And inositol is good for cell membranes. So when our cell membranes are healthy, the nutrient transfer and electrolyte transfer is more efficient. And it's good for our nerve impulses too. And then choline is an emulsifier to control weight and prevent gallstones. And then this also has an effect on the nervous system that produces a neurotransmitter called acetylcholine. And in my office, my MIC injections have an extra C, which stands for cyanocobalamin, which is a vitamin B12, and which also boosts your energy, but it also boosts immunity, and it's great for nerve health too. Are there any questions?
Are there any adverse side effects that you know of for peptides, or any reasons besides the cancer that you would take it?
Yeah, I went over the reasons why you wouldn't take it. There are some side effects, like people can have allergic reactions to them, some drug interactions, like we touched on. One of the big hurdles for us as providers is that these are all like cash pay pieces, and all of the effects are subjective. So that is a hurdle that we have to go through, because if you're not seeing the results that you want, it can become frustrating.
Can you describe what it would look like for somebody to come in, say possibly with IBS, and to go through the whole hormone work through and then get to the other side? What, like a perfect situation, what would it look like?
Yeah, so I mean, maybe somebody who has like anti-aging.
Yeah, perfect.
Okay, so if you're like thinking that you might be going through menopause or perimenopause, and you're having like increased central adiposity, hot flashes at night, low libido, depression symptoms, we would come in and I'd actually do my initial evaluation on telemedicine, and you can make an appointment for that on my website, and then we would order labs. And if there are hormone levels that are out of touch or not normal or not optimized really, then we could talk about different hormone replacement therapies. So we'll be doing creams, patches, and pellets for hormone replacement therapy. We really like pellets because they're inserted just below your skin and your body can draw on them when it needs. So when you're sleeping, you don't need testosterone, but when you're hiking up very peak, you need testosterone, like you need the energy and endurance. So your body can draw on it at those times. Plus you don't have to put it on every day and worry about getting it on your dog after it's on your your skin and stuff. So just easier. So we would optimize your hormones, look at your thyroid levels, check to see if you need more thyroid medication or different thyroid medication. And then also we would check your cortisol and check that. And then we would maybe start Simorelin. But if you had IBS as an alternative option, just having the notes from your like gastroenterologist documenting that you've tried some medical treatments, then we could try with BCP 157. So it would be like a shorter process at our office to do that. But keeping in mind that you've already gone through a lot with your gastroenterologist, so we honor all of that workup.